Good morning, good evening, and everything in between. My name is Daniel, and today I'll be discussing the nervous system, specifically demonstrating the monosynaptic reflexes and discussing what reflexes actually are. So, what is a reflex? A reflex, when most people think about it, is you sitting in an office, getting hit in the kneecap, and profusely kicking the air for no good reason. Now, this is a type of reflex, but it's not the only reflex. Reflexes are involved in muscle movement. They're involved in blood movement and blood pressure by controlling the vesicles, so your veins and arteries. They can contract and not and expand um, based on certain muscle reflexes. Your intestines can do the same thing to move food throughout your system, and fortunately, they're involved in defecation and other processes such as that have to do with excreting things out of your body. So it's just to paint a picture. There's a lot of reflexes which are occurring day to day, which are extremely important in your life. So to understand what a reflex is and how it works, you need to understand what's called the reflex arc. Now, the reflex arc is the very basic structure of how a reflex works. It's your most, common reflex circuit, essentially. So the very first thing you need in this circuit is a stimulus. Now, in the case of you going to the doctor, the stimulus would be your doctor hitting you on your kneecap with a reflex hammer. So if he hits you, he's hitting you directly on a receptor. So a receptor is one end of a sensory neuron. This will send a signal cascading down your sensory neuron all the way to your spinal cord. Now, when the signal hits your spinal cord, there's two scenarios that can occur. One is where in this circuit you have an interneuron, and one is where you do not have an interneuron. So there are two variations where the circuit is missing an interneuron, or has it. When you are missing it, this is called a monosynaptic um, reflex. When you do have an interneuron, this is called a polysynaptic reflex. Now the main difference here is that in the time scale, in the relative time scale of this whole reaction, the interneuron is causing this reflex to slow down. So in cases of polysynaptic reflexes, they are generally slower than your monosynaptic reflexes because there is only one circuit change in a monosynaptic reflex as opposed to this polysynaptic reflex which has the interneuron. So once it has passed through the interneuron or not passed through it, it moves on to what is called the motor neuron. So the motor neurons are associated with movement of muscles and skeletal muscles and things like that. So they are the ones directly affecting the effector organ or the response. Okay? So once the signal reaches the end of the response, you've completed the reflex arc and you've caused some sort of movement or some sort of organ to be activated. Now, to reiterate everything I've said about the reflex arc diagram, I'm going to simply go through all the 5 components of the reflex arc just so that you have a better understanding with more simple definitions. So again, a receptor detects a stimulus and propagates a signal into the sensory neuron. The sensory neuron then receives the signal and transports it to the spinal cord. Once you reach the spinal cord, if an interneuron is present, then you have a polysynaptic reflex. If an interneuron is not present, you have a monosynaptic reflex. From that spinal cord, you will then transfer the signal into a motor neuron. Once it is in the motor neuron, the signal will pass through to an effector organ, causing an effector organ response. Now, the effector will respond and initiate what's called an action potential. So every time a signal is passed through a neuron, that is called an action potential. This action potential, in turn, will initiate a flexion or an extension of a muscle. So now that we have a thorough understanding of what a reflex is, how they work, and what this reflex arc actually looks like, I would like for you to go ahead and continue on to the virtual lab. So the virtual lab's goal for this experiment is to learn to activate and identify types of reflexes using a reflex hammer. So the reflex hammer is the tool that we talked about where you go to the doctor and he hits you on a reflex point and he looks at the response. So you're going to be doing that same thing. You're going to be testing out a reflex hammer on various patients and various sites. So by sites, I mean various muscle groups. And you're going to be testing whether or not a reflex can be achieved. So once you've done all of this, you're going to have a better understanding of where these reflex points are, what they mean when they have one, and what they mean when you do not have one. So that's the most important question you can ask yourself, is what you can actually learn from a reflex, or more importantly, what can you learn from the lack of a reflex? So keep these questions in mind when you reflect back on this information, because it will help you better understand quiz questions and exam questions if you can answer this question. And with that, I'll leave you guys to it. Have a great weekend and good luck on your finals.